Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the sixth video of repeat revision course of oral medicine, which is very important for NLE exam, MDS, NBD as well as for BDS students. In this video we will discuss about oral submucous fibrosis. Now oral submucous fibrosis is important for NLE exam because there are two characteristics of oral submucous fibrosis is very important for MCQ's point. Number one, in oral submucous fibrosis, there is a limited mouth opening. Second, in oral submucous fibrosis, there is a high malignant potential. Meaning 30% patient with submucous fibrosis, squamous cell carcinoma occur. And next, in pharyngeal region, there is a band formation in oral submucous fibrosis patient. Now, first, what the word oral submucous fibrosis mean? Oral mean oral. Submucous fibrosis. Fibrosis mean deposition of fibers, and submucous mean below the mucosa and submucosa, especially in lamina propria and below in connective tissue. There is a fibrosis, mean deposition of fibers. In the result, there will be limited mouth opening and mucosa will be stiff. Now, first we start from definition of oral submucous fibrosis. Oral submucous fibrosis is a peculiar precancerous disease. Mean it is a peculiar. Mean it is separate from other. Why? Due to high malignant potential, and it is mostly occur in India and some parts of Asia. Etiology is exactly unknown but may be attributed to three factors. Number one, hypersensitivity to dietary habits of consuming strongly irritating spices. Mean if a person consume strongly irritating spicy food, in the result there will be if a patient have hypersensitive allergic reaction to that spicy diet, in the result there will be oral submucous fibrosis. Second, chronic and frequent exposure to potential irritant of tobacco or chewing betel nut. Mainly the chewing betel nut is the cause of oral submucous fibrosis. And chronic and frequent exposure to potential irritant of tobacco or betel nut. Third is a nutritional deficiency. Now come to the age. In which age oral submucous fibrosis occur? From means second to fourth decade, from 20 to 40 years. Cite any part of the oral mucosa and sometime the pharynx, and its onset is insidious. And chief complaint, there will be burning and discomfort on eating spicy food. When patient eats spicy food, in the result there will be burning sensation in the oral cavity and discomfort. Now come to the clinical features. In clinical features, look at this diagram. Here in pharyngeal region, there is a band formation, there will be vesicle on pharynx, and there will be limited mouth opening due to this stiffening of mucosa, and it can involve the vocal cords. Then there will be difficulty in speech, and it can also involve the eustachian tube, and the hearing also will be affected. Now come to the clinical feature. The oral mucosa may reveal, number one, vesicle formation, especially on palate. Here on palate, vesicle formation. Next is the loss of normal pigmentation. The normal pigmentation will be lost. Like here there is a yellow-red pigmentation. Tissue elasticity leading to stiffness. Mean there will be, due to fiber deposition, tissue elasticity will be stiff, leads to stiffness of, number one, tongue, stiffness of tongue. In the result, there will be interfering with speech and tongue protrusion. Patient are unable to protrude the tongue, and there will be interference in speech due to stiffness of mucosa of tongue. Second, cheek mucosa stiffness, causing limitation of mouth opening. Why mouth opening is limited in patient? Due to cheek mucosa thickening. There will be inefficient mastication. In mastication, there will be difficulty in whistling, blowing, or sucking. Next is the Blanche atrophic epithelium. There will be blanched atrophic. Blanched atrophic epithelium means there will be atrophy, and blanch means looking white. Look at the epithelium is looking white due to less blood supply in that area and due to more fibrous deposition. Next is the their Blanche atrophic epithelium, atrophy of tongue coating. Tongue coating, in the result, there will be atrophy of tongue coating. Next is the erythroplakia or leukoplakia in the oral cavity. Next is the fibrotic band on cheek, lips, and palate. Here there is a scar, fibrotic bands on cheek, lips, and palate. Next, there will be excessive or diminished salivation. Either there will be excessive salivation, means cyalloria, or diminished salivation, means xerostomia. Third is a change in voice when vocal cord involvement occur. In result, there will be changes in voice. Next is the impairment of hearing when eustachian tube involved. Next is the squamous cell carcinoma has been described in 30% of patients with submucous fibrosis. Mean patient with submucous fibrosis have high malignant potential. In 30% patients, there will be squamous cell carcinoma. Now come to the treatment. Treatment, we give a stretching exercise per patient. Next is the surgical excision of these fibrous bands. And next is a systematic topical and intra-lesion steroid. We give systematic steroid or topical apply at that area, or intra-lesion inside these bands lesion. Intraoral steroid are used with success but give temporary remission. Mean the steroid give a temporary remission. Mean the permanent treatment is a surgical excision of fibrous bands. This is all about oral submucous fibrosis. Now today our topic is complete. We will discuss next topic in next video. If you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.